Hello, my name is Dwi Agustina. I'm a nursing lecturer, and this is my video. I will present my research study that has been published in Malaysia Journal of Nursing entitled Effectiveness of Diabetes Educational Modules for the Management of Type 2 Diabetes Mellitus, a Systematic Review. With me, Dwi Agustina, and then Johari Daud Makajil by Divin Badiri, Dewi Susana, Winda Maulida, and Mutmainah. Type 2 diabetes mellitus is a chronic disease with a rapidly increasing prevalence worldwide and requires long-term management. However, many patients experience difficulties in performing proper self-care due to low health literacy, lack of family, and limited access to healthcare services. Therefore, effectiveness management requires not only for medical treatment but also educational behavior and community-based intervention that empower patients to manage their condition independently. This study aims to evaluate the effectiveness of multidimensional educational intervention in improving self-management among patients with type 2 diabetes mellitus. This study used a systematic review design following the PRISMA guidelines and the Joanna Briggs Institute methodology. Literature search were conducted in 5 electronic databases. They are PubMed, Scopus, Google Scholar, Science Direct, and EBSCO. Totally of 231 articles were identified, and after step-by-step screening process, finally we found 30 studies met the inclusion criteria and were analyzed using thematic synthesis to evaluate the impact of educational intervention on self-management behavior, glycemic control, and patient empowerment. The result shows that intervention focusing on health literacy, family involvement, peer support, and digital education platform significantly improve self-care behavior, reducing HbA1c levels and increase patient confidence in managing diabetes. Family-based program and nurse-led intervention demonstrate better long-term outcomes compared to conventional education. However, low-intensity or entertainment-based intervention showed limited impact on knowledge improvement and behavior change. Okay, this is discussion section. This review highlights that improving diabetes outcomes cannot rely solely on providing information to patients. Many studies show that knowledge alone is not sufficient to change behavior unless it is combined with motivation, emotional support, and continuous follow-up. Patients with low health literacy often struggle to understand treatment instruction, which lead to poor glycemic control and increased risk complication. Therefore, intervention must be designed according to the patient literacy level, cultural background, and social environment. Another finding is the strong influence of family and peer support on patient adherence. Studies included in this review demonstrate that patients who receive support from family members or peer groups showed better self-management behavior, improving confidence, and more stable blood glucose level. Family-based intervention help patients maintain lifestyle changes because they create a supportive environment for diet control, physical activity, and medical adherence. This indicates that diabetes care should move from an individual approach to family-centered and community-based approach. This review also found that digital and community-based intervention have significant potential, especially in areas with limited healthcare access. Mobile application, online education, and community health program can increase patient engagement and provide continuous monitoring. However, the effectiveness of digital intervention depends on user participation, technological accessibility, and the relevance of the program to the patient's daily life. Without active engagement, the impact of digital education may be limited. Another key point identified in this study is the evolving role of nurses and community health workers. Nurses are not only responsible for clinical care, but also act as educators, motivators, and coordinators in chronic disease management. Nurse-led intervention were consistently associated with better patient outcomes because nurses maintain closer and more continuous contact with the patient compared to the other healthcare providers. These findings support the importance of strengthening nursing roles in diabetes education program. Finally, this review emphasized that successful diabetes self-management require multi-dimensional intervention that combine education, psychological support, family involvement, and long-term follow-up. Program with short duration or low CT often fail to reduce lasting behavior change, while structured and continuous intervention show more consistent improvement in HbA1c, self-efficacy, and quality of life. This finding suggests that future diabetes management programs should be designed as sustainable, culturally adaptive, and collaborative model of care. This approach are more effective than standard care that focus only on medical treatment. Okay, for the future research, it is recommended to evaluate long-term effectiveness, cost efficiency, and scalability of this intervention across different healthcare settings. And then for the implementation of this study can be applied in hospital, primary healthcare centers, and community nursing services by development family-based and cultural adapted diabetes education modules, enable nursing to play a more effective role in improving patient outcomes. Okay, thank you for your attention. See you for the next video. Bye.